The role of education is central to advancing the pharmacy profession to meet the needs of our populations. There simply is no healthcare without a health workforce, and there is no pharmaceutical workforce without pharmacy education. FIP has co-created the FIP Pharmacy Education in Sub-Saharan Africa report with colleagues across Africa and support from the World Health Organization Regional Office for Africa and UNESCO. This first-of-its-kind report provides an overview of the needs and priorities of pharmacy education in sub-Saharan African countries with a focus on academic capacity and needs-based education. The report highlights healthcare, workforce, and societal challenges and provides a decade's worth of evidence on how pharmacy schools have responded to these ever-changing challenges. The report concludes with a set of purposeful way-forward areas and recommendations to strengthen the impact of the report and build on its findings. The findings of this report have shown that countries across Africa need to build a flexible and productive workforce to meet societal and healthcare challenges. Investments in academic pharmacy workforce to address migration and shortfall issues and implementation of needs-based pharmacy education strategies are required to advance pharmacy education. FIP Pharmacy Education in Sub-Saharan Africa report recommends that addressing inequities in pharmacy education, establishing intra-regional and institutional educational partnerships, building foundations of an African Association of Schools of Pharmacy will contribute to the advancement of pharmacy education across Africa. Looking at the needs and priorities of society, healthcare, workforce and pharmacy education, the report identifies a severe shortage of health workforce in Africa. Pharmacists are integral to meeting the healthcare needs of the region. Building a competent, adaptable, and flexible pharmaceutical workforce through needs-based education and skills development is mission critical. FIP's global frameworks and tools provide significant value in identifying the needs and priorities in pharmacy and pharmacy education. Pharmacy degrees are shifting from B-Pharm to the more patient-oriented PharmD program across sub-Saharan Africa. Shortfall of academic staff, insufficient experiential learning opportunities, poor infrastructure, and limited funding are among the key challenges in pharmacy education. Providing decent working conditions can address academic staff shortages. Pharmacy education needs in West, South, and East African regions vary, and intra-regional partnerships ensure quality and harmonization of pharmacy education. There has been an increase in workforce capacity in Africa as measured by pharmacist density, although not for all countries. The workforce capacity gap between African countries, based on income level, is increasing over time. The disparity reveals a significant effect in terms of accessing pharmacists, and that gap will continue to increase in years to come. Funding pharmacy workforce will influence national health workforce density and economic growth, because pharmacy workforce is the third largest healthcare workforce in most countries. Established in 2010, the FIP UNESCO UNITWIN program aims to advance research, training, and curriculum development in pharmacy education by building university networks. FIP UNESCO UNITWIN Center for Excellence in Africa was FIP's active regional network focusing on developing academic capacity, establishing needs-based education, and enabling pharmaceutical policies through advocacy. Over a decade, FIP UNESCO UNITWIN Center for Excellence in Africa facilitated intra-regional academic partnerships and exchanges, joint research, advocacy coalitions, enhancement of quality assurance in pharmacy education, increased academic capacity, and access to resources. The FIP UNITWIN Needs Assessment Framework builds on FIP's pharmacy education resources and tools developed over the past decade. Member institutions from FIP UNESCO UNITWIN Center for Excellence in Africa performed an education standards assessment using FIP Nanjing statements. Curriculum assessment and mapping have been made through FIP Global Competency Framework. FIP pharmaceutical workforce development goals facilitated the workforce needs assessment and a comprehensive scope of practice questionnaires analyzing the state of pharmacy practice and education in the countries. This report provides comprehensive pharmacy education country profiles from Ghana, Kenya, Malawi, Namibia, Nigeria, Uganda, and Zambia, which can be scaled up to all countries across Africa. Quality assurance in pharmacy education has been the cornerstone of this report, and findings support the implementation of new teaching methods and innovative training models. For a quality education, continuous curriculum review and more academic pharmacy staff are needed. Young pharmacists groups are champions of continuous education initiatives across Africa. Pharmacy students and young pharmacists associations play a critical role in pharmacy education across the region. Students and young professionals across the continent call for increased experiential learning opportunities, mentorship, and support to engage in national, regional, and international pharmacy initiatives. There are major barriers to overcome to achieve gender equity for women in pharmacy education and pharmaceutical sciences across Africa, as in other parts of the world. FIP-wise, Women in Science and Education movement provides a solidarity network to support women in these fields to achieve their full potential. Good practices such as institutional support to improve teaching, participation in leadership positions, career development opportunities have been tools used to empower women in education and science. FIP-wise is committed to reforming systems that no longer serve women in pharmacy education and pharmaceutical sciences. While we were working to deliver this important report, the world has been amidst the COVID-19 pandemic. COVID-19 has exposed and magnified existing inequities in pharmacy education as education has been heavily disrupted due to the pandemic. Adapting to remote learning initiatives in resource-limited settings has been challenging. Colleagues who were part of FIP UNESCO's Center for Excellence in Africa shared knowledge, resources, experience, and good practice to ease the disruption through solidarity, which are described in this report to support colleagues across Africa and beyond. Establishing intra-regional and institutional partnerships and building the foundations of an African Association of Pharmacy Schools will contribute to advancement of pharmacy education and healthcare needs outlined in this report. For the next decade, FIP will focus on the renewal and expansion of the FIP UNESCO UNITWIN program across other regions of the world. We invite all stakeholders across Africa, students, faculty members, national pharmacy organizations, and governments to use this report as a roadmap to advance pharmacy education and pharmaceutical workforce across Africa and throughout the world.